This is Dr. Jennifer Rayleigh over at Incline Chiropractic, Colorado. Today we have Miss Kim Cole with us. She's your fertility teacher. You can find her at yourfertilityteacher.com. So Kim, let's just jump right into some questions. Tell us a little bit about yourself and about your business.
Hi, well, thank you so much for having us on and for being a resource for women in our area. I'm so excited to have you here with the emphasis you have on the pregnancy and the women and the support you're giving them. So I teach people about their fertility. And I've been doing this for quite a long time. In fact, I'm over 25 years now. And my passion for this is so that every woman has this knowledge and that she learns more and how to learn about her body. And I'm so excited everyone that I get to give this information to. Yeah. So the way it started out for me is I had a young family and I really did not want to be putting chemicals in my body. And so I found a book and I struggled with self-teaching, and it really was a struggle. So when I sat through my first introduction with a teacher, there were just bells going off for me saying, every woman needs to know this information and there need to be women teaching them. Because what I found out was there was a lot of nuances and it was really hard to self-teach this out of a book.
Oh, okay, wonderful. That's great. And I mean, I know that I've read some fertility books as well, and it's kind of hard to follow if you don't really know a lot of the background on it. It's kind of the same with chiropractic care. It's really hard to explain to people exactly what it is we do or how it works, especially with some of the techniques we use, such as the activator. So that's a little clicking tool. Some people really just don't understand. So to have someone there to explain it to you, it's much easier than trying to read it out of a book. So I definitely understand that piece of it. So how has COVID-19 affected your business?
Well, I'm definitely not doing as many in-person trainings and teachings. And so it kind of has stopped all of that. And usually springtime is my busy season. And so it definitely has kind of forced me a little bit more onto the online platforms. I've been doing it for a while and we can handle online really well. I mean, I like face-to-face, but so it hasn't stopped us. We've been able to continue, kind of growing and just bringing it in a new way to women as well.
That's wonderful. And so do you specifically see people in a certain region, or now that you're online, you're more remote and you can kind of see the whole general public everywhere?
Yep, if they can log in, they can see them. In fact, I've even talked to people as far away as Spain.
Wow, that's wonderful. So I know I have several patients that come from Pueblo. I have a couple that come from Castle Rock in the Denver region as well. Where can they go to actually meet you in person? Whenever this does all pass and we can meet in person again, where is the best place for them to see you?
Well, usually they can call me and I can tell them where I'm hosting classes. And so I will do group classes and private instruction where I'm invited. And so usually that's kind of held throughout Colorado Springs. And if that's not possible, then we always have the online option if they want to get started right away and they don't want to wait for class.
Okay, great. And on your website, is that where they could go to see where you're going for classes so they could meet you in person?
Well, usually I'll post it, or I'm going to have to we're going to email back and forth where the classes are, where the actual location is. So on their website, they can say we want to sign up, and then I'm going to reach back out to them and we're going to set up their time frame.
Okay, great.
Usually we do an overview of the method. It's going to be a PowerPoint where I'm going to talk to them just like we're talking right here. We get them all the information they need to get started. We're going to get them downloading the app. We have ebooks that they can use, and we'll get them started. And then we do a series of chart reviews where we actually take the method and we're going to apply it to them. We don't ask them to fit into something else. We're going to take the method and fit it into what they're experiencing with their body. And we're going to do that over a series of months, most about half months, before they're able to look at me and say, I've got it now. So it takes a little bit of time, but once they do, it's kind of like learning to speak a new language. They have to learn to speak the language of fertility that their body's trying to tell them.
Okay, so what is it that you guys do, just so that they have like a better understanding? Like you said, I know that they could go online and find all this stuff, but what is it about your service that makes you special?
I actually do private chart reviews. So I'm going to tell them what they need to be paying attention to. I'm going to clarify and fine tune what they're actually keeping a record of each day. And then I'm going to help them interpret that so they can read their chart and know day to day, am I fertile today? Could I get pregnant if we were to be intimate tonight? Or am I not fertile? And so the chart is going to just be a tool that can tell them, am I pregnant, or am I more likely to get pregnant today, or am I less likely? We're also going to, in couples who are trying to achieve, we're going to shorten the time it takes them to achieve that pregnancy. And so it's very valuable to use it to achieve a pregnancy.
Great. Does it have stuff like nutrition on there and exercise and just like all the things, or is it more of like what they do to take like body temperature and things that they're just monitoring on themselves, or is it everything?
It's actually just going to be cervical mucus, and we can see all the information that we're going to need. We're going to teach them how to track it, how to pay attention to the pattern, and it's going to give them a lot of information. I'll point them in some research or in some directions of nutrition and things they can do, but primarily it's just going to be learning how to read what their body is already telling them.
Okay, great, excellent. So let's see here, kind of going back to the COVID-19 thing, what is you and your family, what are you guys doing right now to kind of stay healthy and happy and social distancing and all that stuff?
You know, with my family, I've tried to do positive and give us some fun things to focus on. And so we got baby chicks over this time. And so for the last 4 weeks, we've been watching our baby chicks grow, and all my kids started to plant the spring garden. And so that, I think, is kind of been our funnest focus right now, just to kind of take our minds off of it and give them something to put their energy towards.
That's great. That sounds awesome. How fun is that? That's wonderful. Okay, so next up, do you need to make obviously for online, you need to make an appointment whenever you do the in-person visits, for the classes that you host? Do they need to sign up for those, or is that a walk-in situation, anything like that?
No, usually I set up a series. Even when we do it online, it's easier just to know, hey, on Tuesday nights, we're going to be meeting for this. And so we do try to get a series set up. We set the appointments, but we can accommodate most work schedules. We can get people worked in. And so typically they're not having to wait too long.
Excellent. That's really nice. Sometimes it can be hard to schedule with people, but right now it's super easy. So, Okay, so what's a typical visit look like for people whenever they communicate with you? What's typical between the two of you? First interaction, every other interaction after that. How often do you guys get it together to kind of discuss what's going on?
It's usually more in the beginning. We usually spend about an hour and a half in the first visit. The second visit's going to be 2 weeks later. We're going to spend about 45 minutes together, and so usually it's only going to be about 30 minutes or less once they understand what we're looking for, and it's going to happen about every 30 days, so about every 4 weeks. And so that's typical. There are situations where we might need to meet sooner, or maybe we need to stretch it out a little bit, but that would be the most common for how we would meet.
Okay, wonderful. And so whenever people, do you send them these tests, or do they just go to the store and then they can pick the tests up there and you help them interpret them?
It's going to be an app, it's going to be a paper. There's lots of different ways to do it. And so most people today do an app on their phone. There's not going to be any other expense, no other testing that they need to do. All the information we're going to be able to get from the woman herself. It's really simple, it's really quick, but it's also really reliable. There is nothing more reliable than what we're going to teach the women to track.
Great. And so is the app, is it the Your Fertility Teacher? Is that an app that you guys created, or is it just an app that you like to use that's already?
We actually use NFPcharting.com does a great app. There's a couple of other options for people. There's about 4 different platforms for how people how they like to chart. And so part of it is finding what works for the woman herself. And so we can be a little bit creative if somebody says, this doesn't work for me. I'm forgetting to charge my phone and I'm not getting it done. We have a couple of other options that we can offer them until we find something that works for each person.
Okay, wonderful. That's great. I know there's several different apps out there to help people kind of track ovulation and all that. I've actually asked a question in a couple mommy groups about like what they're using so I can make some recommendations to patients. So that's wonderful that you have something that you really like to use and that you can recommend to people. So how much would you say is a typical, what can people expect to pay whenever they come to you for your services? Because that is something that's relevant right now. You know, people aren't working, but it's also relevant when people are working because, you know, at the age of
Yeah,
fertility,
I
people,
really have worked hard to make it affordable.
Mhm.
And I've also worked with people, I'll even let people make payment plans if they say, we can't afford to pay that right now. I'll break it up to what is affordable for them because I really want the information in the women's hands. And so my most basic or most affordable package starts at 135. And so that's not a lot of money. And then once they understand it, it's the information for their lifetime.
Yeah, that's great. That's wonderful. That I mean, that is really affordable, especially if you could break it down into payments. I mean, shoot, then it's, you know, not very much a month in order to do that. So how is the success of your business? Do you see a lot of success and or do you see women that struggle or do you see a little bit of both?
I think that the struggle part is if people don't actually do the chart reviews. So if they just go through the basic instruction, well, then they're informed, but they haven't been instructed. But if they actually take the time to go through at least 2 or 3 chart reviews till they really understand it, the success skyrockets. Couples that I've even tracked my teaching success, we match the method of over 99% effective. It's as effective as the pill in avoiding, and it's as effective as IVF in helping couples achieve.
Oh wow, wonderful. That's great. That's fantastic to hear that.
It's exciting. It's a
Yeah.
natural alternative that it's like every woman needs to know this. They need to be talking to their aunts and their sisters and, um, you know, get them off all the hormones.
Yeah, no, I definitely agree. I've seen a lot of good and bad things come from hormone imbalances. So, and I'm just taking a shot in the dark. Insurance doesn't cover something like this, correct?
You know, I need to be teaching in a doctor's office. There's a lot of protocols. Insurance will in some cases cover it, but I try to just make it affordable so we don't have to even deal with all the paperwork side of it.
Yeah, well, that's wonderful. That's great that you're able to do that. So, before we wrap it up, let me just ask you a fun question. Let's see here. What's your favorite color?
Blue.
Blue. Okay. So, how would you describe the color blue to someone that's been blind their entire life and has never seen the color blue? How would you describe it to them?
Oh, let's see. Blue. Blue's hard.
Yeah.
Blue is a strange, hard one. Um, Maybe wouldn't go with the warm towel out of the dryer exactly. So just the perfect stream water as it's running by. That's just the perfect temperature that you put your feet into. That's blue.
I like that. I like that you put some feeling into it. That's wonderful. So, okay, excellent. Well, thank you so much for joining me today. Is there anything else that you want to say? You have any health tips or anything like that for people that are at home right now on how to stay healthy while this COVID thing's going on? Anything else you'd like to mention?
No, you're going to get them healthy as soon as they get back into your office. So
Yeah.
starting on Monday, that'll be the first tip. And so I appreciate you bringing me the chance to bring in here and just to even raise awareness that this is even a thing. And so I'm grateful. Thank you.
Yeah, wonderful. I mean, I feel like we all need to work together in order to achieve goals with some people, especially some more than others. So, well, thank you so much for joining me today. Everybody else out there, have a good rest of your day and be well.